3, 2, 1, let's get started. Hey everyone, welcome back for our next video. I'm your host, Dr. Curtis, your digital doctor of physical therapy. This next video is taking a next step into correcting our sitting posture. If you've seen our previous ones on postural correction, we talked about an X pattern where there's tightness and weakness on different parts of the neck and upper back. We went over the shoulder clock, which is a great rehabilitating drill for the shoulder girdle. Today's video, I'm going to show you 2 stretches in this area for lasting change, okay? So often people will come to the clinic and say, you know, I've got this lump in my back here, this bump. And normally our cervical thoracic spine, there's kind of a little S-shaped curve, and that's normal. But over time, because of so much forward head, forward work, sitting posture, we actually start growing into this posture. And after we sit up and stand up, it kind of doesn't go away. So people often ask, can I get rid of that? So I want you to think of these concepts. If it's taking you a long way to get that way, it's going to take a similar amount of time to change and stretch and remodel those tissues. So for instance, if you wake up with a crick in your neck and it's been there for 2-3 days, that might be a pretty easy thing to actually manipulate, and sometimes people are better in one treatment, and that's always cool. That we'll get to at some point. But these stretches for the cervical thoracic area and postural correction are for real change, okay? So postural correction and sitting up from your chair relieves tension in that area, going in the right directions. Now we're going to take that next step further, go in the right direction for making lasting change. So if you, we could start this way in a nice sitting posture. So we're going to correct this rounded back, forward head posture by giving you 2 stretches, okay? And that is for the tightness of the upper and lower thoracic spine, and then of the rounded shoulder pec area, okay? So these are very simple to do. And again, if you have any pain, sharp pain, you would definitely want to respect that and back off. And since we're getting into stretching, certainly consult your health provider to make sure that starting an exercise program is appropriate. So this chin tuck, we went over this already. Chin tuck, and then the shoulder pinch, chest out. Now we are going to do these as a stretch. So the chin tuck, you're going to chin tuck and roll. Okay? Chin tuck and roll. So what this does, it gets each cervical vertebrae and the muscles kind of segmentally. Okay, we're going to start at the ear. You're going to see my head kind of pivot just like this. Chin tuck and roll. And I'm putting a little bit of overpressure to get a nice stretch. Chin tuck and roll. So let's break that down. You notice I'm not pulling down, okay? So if I didn't chin tuck and if I pulled down, it would look like this. If I would just sit here with the forward head, rounded shoulders, and pull down, guess where I'm hinging at? Yes, that's right. My lower neck and base of upper thoracic spine. That's already getting a lot of overuse with sitting posture. What we want to do is stretch this upper area, okay? So this is what you don't want to do, give you a visual, is to pull down in this forward head and hinge. That's what we don't want to do. We already have too much of that. So what we want to do is a little chin tuck, or make a double chin. How do you know if you're doing a chin tuck right? Just make a double chin. Of course you can't see it, but you're doing this. Little chin tuck. Grab behind your head. And I am trying to pull across the room in a horizontal arc. Okay. I know arcs don't go horizontal, but rather than horizontal line, you're kind of shooting for this type of arc with your little gentle stretch and overpressure. So chin tuck. And roll. Yeah, that feels really, really good. If you have anybody massage your upper neck area, especially even into the bottom or base of your skull, those little muscles there can cause a lot of tension and squeeze blood vessels that go up that can cause a lot of posterior occipital headaches. So I've got this little bump on the base of my head as well, and it's a nice little hook. It's almost like an Adam's apple of the base of your head. It's actually the structure of your head, so you're not going to hurt anything by pressing on it or using it as a kind of a rock climbing little hook like this. All right. So it's a nice convenient little hook to grab that chin tuck, and then a nice horizontal arc. Again, don't go down this way. All right, that's the first exercise. Chin tuck and a nice little stretch, and you're going to count 15-20 seconds or so. You don't really have to hold this one. 30 seconds is kind of long. Usually that's bigger muscle groups, but these small muscle groups, you don't really need a lot of force because it's a lot smaller muscles. Chin tuck and roll. Chin tuck and roll. Yes, it does mess up your hair a little bit in the back, but that feels really good. Okay, so that's correcting the forward head. The next one, we're going to correct these tight pectoralis muscles. So like I said, the longer a problem's been this way, kind of the longer it takes to stretch it out. So just hourly exercises, postural correction is one thing. Just chin tuck, shoulder pinch, chest out. We call this what, the cat cow. I don't really like calling it a cow exercise. Do the cow exercise, it doesn't really make sense, right? Cat makes sense. Do the cow exercise. I like shoulders back, chest down, okay, or shoulder pinch exercise. It's a lot more descriptive than the cow exercise. So this one here, this is for movement, moving in the right direction. To make lasting change, we need to stretch that and provide some sustained pressure on that area. So this is a simple pec stretch, and I like to just grab a piece of furniture. See if I could do it this way. You could do it unilaterally, one side or the other. A little hard to do it both at the same time. But if I kind of just put my arm around my chair and then turn my body toward the camera, opposite of where I'm being stabilized, my arm, it is pulling the pec insertion on my arm and stretching and pulling my little humeral joint, my scapula back that way, and I could feel that right here. Oh, and it's super, super tight. The pec muscle is a big muscle, powerful muscle, and this is a thick tendon insertion. You can even palpate that as well. It kind of forms the anterior part of your armpit, that massive tissue there. For some of you, it might be skinny. For some of you, it may be massive, okay? That is what we're trying to stretch, okay? And I suspect we often don't stretch in this position very often. Now, one precaution is in this is your brachial plexus, your nerves of your neck flow through this area. And so you can feel not just your brachial plexus, but what we call your neurovascular structures, your arteries, nerves, and veins are flowing through that area. So you could cut off the circulation, you could feel your hand go numb. So if that's the case, you need to back off, okay? So here, our primary structure that we're stretching is our pec major. And you can see, you know, if I wanted to do this military posture, especially if we did that, the shoulder clock, if we go to 3 o'clock and 9 o'clock, you know, we can only hold this position so long. And guess what? As soon as we relax, doing, we kind of snap back into our posture, okay? So you hold, it's kind of like a coiled spring. So we really need to gain range of motion, gain flexibility of the anterior pec area.